All right. Welcome, welcome to our restorative motion class. This is a combination of our three classes. It's going to combine our muscle pump class, some aspects of that, some aspects of our restorative stretch class, and our yoga class into what I call a restorative class. I designed this class to just give you an idea what restorative motion is all about. And I say this with 100% guarantee that something today I'm going to tell you hopefully will change your life for the better. Okay? I hope so. I know it has helped so many people in the past. That being said, guys, postures, motions, and stretches is like lotion to our body. And if you do it right, it's really good lotion. And what we're going to try to aim at is to try to improve both our muscle and joint function through these motions, stretches, and postural changes. Let's talk about posture first. Posture is so vital for our health and well-being. If we have poor posture, we don't breathe right, we don't move right. And what we see a lot in our practice is people coming in with forward head, and that looks like this, rounded shoulders, that looks like this, and a hunchback, that looks like this. You can see how that affects the back. Because all the seated posture, we have to reverse that. There's no best posture, okay? Because I always say the best posture is your next posture because you're constantly moving. When you move, that's like lotion to the joints. But some of the better posture is where your head is lying back over your shoulders. You're not rounded like this, you're back. You have a nice lumbar curve. And when you stand with knees bent. That is good posture. And that's one of the things that we're going to talk a lot about as we go through these motions. And the nice thing about when I teach you to go into these motions, you're conditioning your body. You're strengthening muscles that are weak. At the same time, you're stretching muscles that are tight. That's a take-home message. Even though you might drop out of a good posture, by pulling yourself back in, you're continuously strengthening and stretching yourself during the day. So posture improvement is one of our goals. Adding more motion to your day is another one of my goals, okay? Because motion is lotion. Your joints get nourishment from motion. If you don't take your joint throughout a complete range of motion during the day, it's not getting the nourishment to heal, to function better. So I'm going to show you a variety of motions. That's one of the hallmarks of this class is motion. I like to stretch. I stretch all the time, but motion trumps stretching all the time. Stretching just gives you a momentary relief. Motion gives you a long-lasting relief, okay? Motion instills a strength development, it improves posture better. Stretching is short-lived, it has its place, okay? And studies have shown if you have tightness, if you have muscle imbalance, it's strengthening motion that usually helps more than stretching. But we are going to include some stretches. And so the features that I talk about when I work with people about stretching is that there's no benefit from being hyper flexible. Actually, it can hurt you. Studies have shown people that have hyper flexibility have more joint issues, more lower back issues specifically that I see a lot. Okay, we want a balanced amount of flexibility where it's normal, both sides are the same. We don't need to be hyper flexible. We need to be mobile, and that's why we're going to stress motion. Okay, so that is some of my big spiels, okay? But before we get going, I want to bring out one big point about posture. I want you guys to remember this. We want to retain slight curves to your neck, okay? So you're not forward head where it's flat. That's important. A slight curve to your upper back, not excessive, okay? And also a slight curve to your lower back. Okay, a lot of people have flat back because they're seated like this. It's one of the worst seated postures to have a flat back. You want to have a nice neutral back, okay? And also, when you stand, you should have a slight curve at your knee. It should not be straight. That's why I'm wearing these fun pants today. It's like that really is detrimental when you stand on lock knees. Because a lot of people are doing work from a standing station. That's important, but it's good to keep your knees bent. Okay, shift your weight, maybe put your foot up. You should not stay standing lock knee. And if you stand a lot, it should only be about 50 to 75% of the time. You shouldn't stand 100% of the time. That's not good either. All right, so that's my spiel about how posture, motions, and stretches are so important to restoring your body, especially after a hard day of working at the computer like this, or say if you work out, you need to restore some balance to these simple, let's just call them all motions. All right. So let's get started. Thank you for coming out. I'm recording this, so if you want to go through it again, you can cut through this whole spiel I just did. And we can go right to our motion series. I'm going to start in the seated position. So I want to give you some armament that you can do this all day long, even when you're in the car or you're at your desk, you can do these motions. All right, the first thing I'm going to talk about is breathing. Breathing is so vital for your health, especially diaphragmatic breathing, and you can reduce stress, but it also stretches out certain things and it offers a deep compression of your spine when you take a deep breath. And like I told you before, joints like motion, kind motion, not crazy motion. You know, like playing sports, really not great for your joints, but kind motions are structured exercise programs like weight training or even running. They show less arthritis with that. But your joints also like a degree of distraction where there's a separation, say from hanging lightly from a bar or taking a deep breath. So when I tell people to take a deep breath, I like it to come from the belly. So I'm going to breathe first from the belly, always through your nose, expand from the belly, into the chest, hold it, and then let it out through the mouth, okay? So let's do a couple of those cycles. Big breath, open up through the belly, through the nose, up through the chest, all the way to the sternum, and then hold and let it out. Okay, one more time, big belly breath, through the chest, up to the sternum, pause, and let it out. That stretches things out, and it also offers a decompression, distraction to your spine, which is so helpful. We're going to come back to some deep breaths later because we're going to use it. Very important point to try to do those deep breaths for a variety of different reasons, just to expand things a little bit more during the day. Even a sigh is good. We have to get rid of some of that old air deep in our lungs, so taking a deep breath or a sigh, very helpful, very therapeutic. And it also is restorative. Okay, next thing I'm going to talk about is eye motion. All day long, you're looking at the screen. What we're going to do now is bring your thumbs out like this, okay? Focus on something in the middle of the room, then turn to your right to that thumb, focus on that, back to the middle, focus on that, to the left, focus on that, back to the middle, to the right, middle, left, come down. You should have been able to focus pretty easily. If not, this is a great tool to do because all day long you're looking straight. This is a motion for your eyes. Now I'm going to go like this. Same thing. Look straight ahead. Focus. Look up to that thumb. Come down. Look down to the lower thumb. Come up. Look up to that thumb. Down. Look down. And then back to center. Again, on eye technique. Motion for your eyes. All right. Now I'm going to go on to some of the things that you're going to feel a little bit more. Most of you guys, I've done this for years. 75% of the people that work in an office or in a lab have rounded shoulders. So if you have your hands like this, where you can put your hands in the front pocket versus like this, how I'm standing, you have rounded shoulders. So we have to prevent that from happening. And one of the best ways to do it, you do this all day long, is a scapular squeeze. So you just squeeze your shoulder blades together and come forward. Squeeze your shoulder blades together and come forward. You can do this at your desk, in a car, squeezing your shoulder blades together, forward. Squeeze your shoulder blades together, forward. Now you can do it with hands down, palms down, squeeze back, and come forward. You can actually feel that stretch in your chest when you go into a better posture, a retracted posture. You're going to feel the stretch in your chest. And you're going to feel those muscles getting conditioned between your shoulder blades. Now let's go into a W. Same thing, squeezing your shoulder blades together. Guys, if you have some posture issues, come by and see Chris and Jen. We can help you with that. Or you can do an online one. Now I'm going to do a T session with you. Squeezing your shoulder blades together. And then up to the Y. Like that. Squeeze your shoulder blades together. And that works on that rounded shoulders. So that's a very important technique. I do that all day long, pulling back. It helps you breathe. When you're rounded, you can't breathe well. And when you're rounded, you lift your arm up, you're actually impinging your shoulder. When you bring your shoulders back, you have more room for your shoulder to move. You feel better, and it actually increases your ability to have more vigor as well. You feel like you can control things better. Now what we're going to do is the chin tucks. Now the chin tucks will help prevent that forward head posture that 70% of the people I've ever tested have it, because all the text neck, all that crazy stuff. So what we're going to do first is go back into that scapular squeeze, because that's a good place to do it. Squeeze our shoulder blades together. Now you're going to retract your head like you're making a double chin. And then relax, retract, relax, retract, relax, retract. Now you're keeping your shoulder blades squeezed together, and you have your chin tucked back, okay? We're going to hold this for a little while. We're strengthening the muscles that are weak in your neck while we're lengthening some that are tight. And then relax. All right, so what we're going to do now, again, squeeze your shoulder blades together. Go back into chin tuck. Okay, now you're just going to turn your head. We're just going to go to the first resistance barrier. Never go beyond the first resistance barrier. Come to the other side. Go to that resistance barrier. And come back. Do that again. And to the other side. To that resistance barrier. And come back. Stay in that chin tuck. Look up. And look down. This should not be painful. Look up. And down. And come back to center. Stay in that chin tuck, keeping your shoulder blades squeezed together. Now I'm going to laterally bend to one side and laterally bend to the other. Just bumping into that first resistance barrier. And come back. And just relax, shake it out. Guys, studies have shown this is one of the best treatments for neck stiffness and neck pain. Pain that's not like needs to be seen by a doctor, but that stiffness, because it works on mobility, motion, out of a proper alignment in your posture. So one more time, squeeze your shoulder blades together, go into the chin tuck. I want you to try to do that once an hour. That one right there is life-changing. I think I already gave you a couple, but believe me, this stuff works. All right, so here we go. We're going to combine all what we've already mentioned except for the eye motion. Listen up. Go back into that chin tuck. Squeeze the shoulder, squeeze your shoulder blades together. Okay? Now go into the chin tuck. Now what we're going to do now, we're going to extend back at our upper back, look up, and take a nice deep breath in. Hold it and let it out. And then relax. What this is going to prevent is that hunchback. So let's do that again, guys. Squeeze your shoulder blades together. Go into the chin tuck. Extend back, upper spine. Take a deep breath in and let it out. Guys, because all day you're like this, we want to go into thoracic extension. Very good technique, very easy to do. You can do that once an hour to free things up, stretch out through here, strengthen back through here. Okay, now we're going to do one of my favorites, okay? A lot of shoulder issues happen because your scapula, your shoulder blades don't move well. So what I want you to do is reach around, separate your shoulder blade like you're hugging a tree, come back, squeeze together. You should be able to squeeze those muscles together between your shoulder blades. Now separate and then hug the tree. These are muscles that you don't use, but you'll develop shoulder problems because you don't have a good scapulohumeral rhythm. Just call it scapular rhythm. So we're going back and forth, hugging a tree, and then come back, squeezing together. And then you can go high with it and low with it. High with it and then low. What we're trying to get to do, those shoulder blades to move. Because if they move well, your shoulders are going to move well. Okay? Again, another test that you can do, I'm just going to bring this up again. When you're done, look at yourself in the mirror. Your thumb should be looking straight ahead. If they're like this, you have rounded shoulders. You need to work on your shoulders. Most people have 1, 2 fingers showing and showing D1. Okay. Now, this is a great technique for people that have like that tight shoulders that Jen sees a lot. She sees so much of this as I do too. You know, that tightness back through here. This is a great technique. What we're going to do is go back into that scapular squeeze, so important, like I say before. And again, this shouldn't be painful, guys. It should not be painful. If it's painful, that you need to work on it. Okay, now we're going to squeeze our shoulder blades together. We're going to go up into a light shrug, and then go down, push down into an anti-shrug, like you push into the floor. Come into a light shrug, and then anti-shrug. Light shrug, anti-shrug. Keep going, guys, as I blur on. Guys, your muscle gets tight because lack of motion. And stretching it alone actually might do more harm than good. Give it what it needs, some light motion. Sometimes just strengthening the ear, sending some blood flow into the ear does better than static stretches. Okay, great. Now what I want to do is bring your elbows up, your fists up. Okay, squeeze your shoulder blades together. Now I'm going to do a rotational shrug. Squeezing your shoulder blades in the back as you come back, squeeze them together. This should feel clean. You might have a leathery spot, that leathery feeling. Just work through it. If you feel like this is hard to do, you're lacking scapular mobility and you need to work on it, and scapular strength. And now reverse it. Same thing. A light shrug and come back. Squeeze your shoulder blades together. Very therapeutic, especially for people that have that tightness up there. Okay, another little test for yourself. Put your hands by your side, palms down. Lift up, overhead, and then come back down. One more time. Lift up, overhead, and back down. Guys, if you have any type of pain or any type of discomfort, you need to talk to us. That's the start of maybe some impingement. I'll give you a little trick. Besides what we talked on, because all this is laid on top of each other to help you move better. And on top of what we already said, what I want you to do, palms up. This is very therapeutic. I tell people every day, palms up. Doing it like this is very, let's say, forgiving on the shoulder because nothing's going to get pinched. Your palms are up. This is a great warm-up activity before physical activity, like working out. And then you can go palms up, come in front, and then around. Palms up allows the humerus, the bone that fits into the shoulder socket, to move more freely. So if you're ever having that tightness in your shoulder, this is a great technique to do. And sometimes I have people bring their arms up after doing that, squeeze their shoulder blades together, and move in and out like this. This is another nice technique for your shoulder. And you can also do the robot, just to free up some of that shoulder space. Good. This should not be painful. If it is, talk to us. We can give you techniques. Another thing that I like to do, combining shoulder mobility with the neck, is bring your hands up. And as we bring your palms up out of the chin tuck, I want you to look down. And as you look up with your head, bring your palms down. Again, all this is done out of the chin tuck. Look down and then come up. This is combining shoulder mobility and your mobility in your traps and also your neck. Don't push it, just always go to that first resistance barrier. Gentle, don't be crazy. And then come down. Another great technique, combining a bunch of different motions into one. All right. Bear with me, guys, on this, because you might think this is boring, but this really is effective. Bring your hands up, okay? We're working down our arms, okay? Hands up. Separate those fingers as much as possible. I bet you guys are all saying, that hurts. Bring them back. Separate them as much as possible, because you don't do this. Back. You're typing all day, separate. Come back. Separate. You're offering motion to tight muscles. Now what I want you to do, face each other, separate those fingers, extend back, forward, extend back, forward, extend back, forward. Keep those fingers separated. Now you're going to come down. Make a tabletop, open up. Tabletop, open up. Remember, your joints like motion. They like good motion. All day long, you're at your computer. Now what I want you to do, take your fingers and make a bear claw to light fist, bear claw, open up wide. Bear claw, light fist, bear claw, open up wide. Bear claw, light fist, bear claw, open up wide. Okay? Now I want you to shake back and forth. Great. Because you guys are like this all day, what I would really suggest, grabbing a rubber band, put it around like your fingers, and open and close like that. Such a great technique. I do that all the time. All right. So the one last thing I'm going to show you about the fingers that is kind of what I talked about before is distraction. Say if you have a digit right here is stiff, you just pull on the finger a little bit and shake it around a little bit. You know, just pull on it. That's distraction. Then you go, you can bend it better. Joints like a degree of distraction, not forceful distraction, light distraction. All right, bear with me, okay? Because we're going to go down. I'm going to have you take off your shoes. I did my fingers. Now I want to look at the feet. All right, so you're going to take your shoes off. Let me get my camera set up here. All right. So what's this guy doing? He's going to have us with our feet. Yeah, so very important. People don't think of their feet, okay? What I want you to do is grab the floor. See how it increases the arch? I'm grabbing the floor. I'm strengthening the arches of my foot. Come down. I'm going to lift my toes up. Okay? Grab the floor. Increase that arch. Strengthen the arch of your foot. And then come back up with your toes. One more time. Grab the floor. This is a great technique you do at home while you're watching TV. Come back up. Lift your toes up. Because a lot of issues start at the feet. A lot of knee issues, lower back issues. Now what I want you to do is go up on your heels, lift your toes up, and then I want you to toe in and out. 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 And then come back down. Great job, guys. Now lift those toes up. Okay. Now what you're going to do is slowly bring your feet back a little bit till you can get a stretch on those calves. And you don't see me. I'm going to have my hands on my knees and I'm going to push down to stretch those calves. Now come back down, lift those toes up, come back down, lift those toes up. Great. You might have found that to be strange, but definitely try to incorporate that because your feet do matter. They really do. Okay, let me put my shoes back on. Hopefully I didn't lose you with that stuff, that crazy stuff. Okay. Key point I'm going to mention now. Very important point. is twisting. From here down, your lower back should always be stable, okay? You should never twist from your waist. Let you twist from your hips or from your ribs up. And this is what we're going to do now. That's why we're in this seated position. We're going to grab the lateral part of your leg, right? And what I want you to do is just twist at your ribs. Okay? And now turn your head. That's a nice stretch. And then come back. Because your spine and your lower back is not meant to twist. That's why how a lot of injuries happen to the spine, twist in there. But from the ribs up, it's meant to twist. That's why when you run, you feel it from the ribs up. Now we're going to do the same on the other side. This is a nice stretch. From the ribs up, turn, and then turn your head. Excellent. We'll do that again to the original side. Grab the lateral part of your leg, twist from the ribs, and turn your head. And then one more time on the other side from the ribs, turn your head. But the take-home message is you don't want to twist at your lower back. Your lower back, that's meant to be stable. One of the worst things you can do is bend over and twist with your lower back. That's how a lot of injuries happen. Okay, now going on to your abdomen. So you're at your workstation, you're in a car. I'm going to give you a couple of techniques that you can do seated. This is another take-home message. Abdominal bracing. Here's your abdominals. I want you to tighten them up like someone's going to hit you in the stomach, or you're at the beach and you want to look good. Tighten up those muscles and then relax. Tighten up those muscles, relax. Tighten up those muscles and relax. A lot of times people are driving in their cars, they might have back pain. I tell them to do this and it takes it away. So the key feature of the abdominal bracing is from now on, the rest of your life, if you're going to lift up something heavy or even something light, you should do a light abdominal brace and then lift it up. That's how you protect your spine. That and also keeping the lower back curved. Two key features. Lower back curve, tightening up your abs, and then you can do that activity. That's abdominal bracing. Most athletes know how to instinctively do that to protect the spine. Okay, now this is one that I have that all my clients like. Like I was talking before about distraction, decompression. In the seated position, I want you to put your hands on your lap, okay? Hands on your lap. And what we're going to do is try to separate your hips from your ribs, okay? Your hips from your ribs. So what you're going to do is push up, and you're going to feel that stretch in your abdominals. I mean, you better make sure you're doing this with a nice upright posture. Push up, and you're going to feel that stretch in your abdominals, and you're going to feel that distraction to your spine, and then relax. Like I said before, joints like a degree of distraction. We'll do that again because it feels so good. Nice upright posture. Push up, relax. That's a great technique to take home. All right. Now, the next thing I'm going to talk about is one of the best things for your knee is motion with not too much load. So if you have a chance during the day, just do some unweighted leg extensions, just like this. This has been documented in a study to be one of the best exercises to prevent osteoarthritis. Just basic leg extensions, and you don't need a weight machine. Nice and light. I do these all the time. I'm going to come back to that later, but very important exercise. All right. So the next thing we're going to go on to is a series of hip stretches that are easy to do. As you can see, I haven't done many hip stretches, but any stretches, but what I want to point out here is the importance of when you go into any of these stretches, you're going to keep your back straight, keep that nice lumbar curve, because when you go into flexion, that stresses the spine. So put your ankle on top of your knee, and you're going to hinge forward at your hips, keeping your back straight. You're going to feel that in your glute. Good. Now you're going to come back and pull that knee up to the chest. This is helping stretch the piriformis. Good. And now push down. Good. You can extend it longer when you're on your own. I just wanted to give you some techniques. But more importantly, I wanted to make sure you understand that you hinge forward at your hips and not your flexion of your spine. Come forward, now pull that knee up, and then push down. Excellent. All right, now we get to stand up. So guys, we're gonna push our seat aside. I'm gonna give you some techniques. All right, big take home message is this next one. You're seated all day long. Not good. You should go about 50% of the time standing. But say if you have to sit, every 20 minutes, you need to stand up, all right? Stand up, and what I want you to do is reach to the sky and lean back and take a nice deep breath in. That big breath that we talked about earlier, through the nose and out through the mouth. Through the nose, out through the mouth. I can't tell you how many times that has helped many of my clients that have lower back issues. All right. From here, what I want to talk about are your glutes. We look at any great athlete, they have terrific glute development. What I want you to do is put your hands on your glutes. It's yourself. Go ahead. It's fine. I want you to put your hands on your glutes, and I want you to squeeze your glute muscles and then relax. Squeeze and relax. If you can't get those muscles to engage, I tell you, you're probably going to have knee issues or lower back issues down the road because the glute muscles are so vital for lower back and knee protection. So glute squeezes, I would introduce that into your repertoire. A lot of people have what I call gluteal amnesia. So if a test would be is hold on to something, straighten out your leg, and extend it back. If you feel most of the action occurring in your hamstring and not your glute, you need to get working on developing your glute musculature, okay? So that's a test. And also it's an exercise. This is a great way to actually develop some glute strength and also lower back stability. I want you to get into a shoulder width base of support. Bend your knees, okay? See how? Bend your knees. Keep the nice lumbar curve. And what I want you to do, keep that nice lumbar curve. You're going to hinge forward and come up. This is an exercise that will help strengthen your glutes and also teach you proper hinge mechanics. Hinge back and pull through. So you're hinging back at your hips, not your lower back. So that when you go to squat or pick up anything, you're going to hinge back and you keep that nice lumbar curve and pull through. So this is a nice technique. It's called a hip hinge. Keeping that nice lower back curve. Now, a lot of people say, Chris, I want to stretch out. I want to touch my toes. That's actually one of the worst things. You do any of our stretch classes, we never have you touch your toes. Matter of fact, the military got rid of toe touches in windmills out of their repertoire because it was hurting people. The compressive forces on your spine are tremendous. So if you want to stretch your back in a standing position, get yourself into that hip hinge, come down like you're playing shot stroke. See my lower back curve? You're unweighted on your hands so you can flex and extend out of that if you want to get a little bit of mobility to your lower back. But never bend forward to touch your toes. It's one of the worst things for your back, okay? Now I'm going to show you what another exercise that is a take-home exercise that has helped so many of my clients, especially those with lower back and knee problems, okay? So what you're going to do, hopefully you have something sturdy to hold on to. This is called a supported squat. So I like using a doorknob. So you're going to hold on to the handle or some support, and you're going to hinge back. That hinge back, you're going to go into a squat, and then come back up. Into a squat, come back up. Into a squat, come back up. When you do this, all the work is happening in the glutes. You can see my leg is pretty much perpendicular to the floor. There's no stress on the knee. It's developing good hinge mechanics and glute development. But you have to hold on to something when you do that. That's one of the hallmarks of any of my low back and knee care programs because it doesn't stress the knee and it develops good glute control. All right, so the next one I want to show you is a series of exercises that will help in so many ways, okay? One, it perfects balance, okay? And when you have good balance, you have good core stability, and you have good lower back and knee control. But what I want you to do is go back to what I said before about gripping the floor with your toes, because it all starts there. Keep one knee bent slightly. And what we're going to do is a leg out to the side, pause, and come down. I do these every day. It works on my balance. If you're having difficulty doing this, you need to work on this. We're going to do a couple on one side and then do the same thing. Grip the floor. Start with gripping the floor. Knee is bent, and this helps develop the gluteus medius, which is so important for knee control. Believe me, if you have knee issues, this is one of the exercises they usually prescribe. You're working on balance, you're working on foot control, you're working on so much. Now what I want to do on the same vein is grip the floor with one of your feet, and you're going to do leg rotations. This is helping hip mobility. Also, you're working on all the stuff I already talked about. You're working your core. You're going to go one way, and then you're going to go the other. Awesome. I'm going to do the same on the other side. Grab that floor. Own the floor. Try not to touch. You go one way, and then the other. Such an important exercise. And you can also do it with your knee up like this. Also, we do it like a kickback, an airplane, or a golfer squat. All very important, but grip that floor with your toes. It's so important. Okay, now I'm going to go and show you a couple of really nice stretches to do for your hip flexor because that muscle gets tight on people, and I haven't done many stretches. And this one knocks a lot of things off our list. You're going to put your foot up on a chair, and you're going to go in and out. So the back foot is flat, this leg is straight, and what this is doing is stretching out your quad, your hip flexor, your calf, but even more important, it's offering mobility and nourishment to this knee joint. Okay? In and out. And then at the end, you're going to come forward and you're going to reach up to the sky and lean back. This is a great hip flexor stretch. We'll do the same thing on the other side. We're going to go in and out. Again, offering nourishment to this knee joint. Motion is lotion. Foot is flat. And then at the end, you're going to push out and reach up like this. Awesome. All right, so now what I'm going to show you is a couple other techniques with your foot up on the chair. Again, talking about how to keep that curve, protect the curve to your spine. You're going to hinge forward. You don't want to flex your spine. You're going to feel that hamstring stretch. Okay, that's a better way to do it. If you lean forward, that's just working the lower back. We want to stretch the hamstring. Come off, and in the relaxed position, grab your kneecap and just move it around because your kneecap needs some mobility as well. Awesome. We'll do the same thing on the other side. Foot up, hinge forward, just feeling the hamstring. Come back, grab the kneecap. All right, guys. I'm going to end with what I feel is a nice stretch. Kind of encompasses a couple of things we already mentioned. I want you to put your hands behind your head. Okay, you're going to find a wall, and you're going to press your elbows into the wall and lean into the wall. Now you're going to take a nice deep breath in and then out. In and then out. And that opens things up and combines the breathing that we mentioned and also loosens up some of the tension that we developed. Guys, I can't say enough about how important these motions are. I have a lot more. They're embedded with our restoration classes. You should join us for some of them. Also, they're in our muscle pump and our yoga classes. That being said, I can keep going on, but I wanted to cut this to 40 minutes so that I could post it on YouTube. I'm going to turn off and come back on to answer questions.